Facebook came to the rescue after an appeal. A metal detectorist found it.
She said yes, by the way.
That'll be a story to tell the grandkids.
Waking you up to the UAE's conversation. Talk Breakfast with Vivek Sunil and Sobia Khan on Talk 100.3.
जी चल रहा है टॉक ब्रेकफास्ट ऑन टॉक 100.3. बातें ऑन एयर ऑफ एयर ये सारा सिलसिला 11 बजे तक चलता है. बहुत अच्छा लगता है जब आप हमारे साथ जुड़ते हैं मैसेजेस द्वारा, या आप हमें कॉल भी कर सकते हैं ऑन 800-81003. इट्स अ टोल फ्री नंबर. एंड साथ ही साथ आपको बताएंगे कि हमारे साथ होंगी डॉक्टर सरला कुमारी. शी इज स्पेशलिस्ट फिजिशियन डायबिटोलॉजिस्ट फ्रॉम कैनेडियन हॉस्पिटल दुबई ऑन लाइफस्टाइल एंड डायबिटीज़. जैसे आपको पता है कि माह रमज़ान का मुबारक महीना आ रहा है, फूड हैबिट्स में बहुत सारे लोगों के चेंजेस आने वाले हैं, तो हमने सोचा दिस इज द टाइम कि हम डॉक्टर सरला से जुड़ें और डायबिटीज़ के ऊपर और भी बात करें. इस वक्त हमारे साथ ऑन एयर है. गुड मॉर्निंग डॉक्टर कुमारी. इट्स अ प्लेजर टू हैव यू इन टॉक ब्रेकफास्ट.
Good morning. It's my pleasure to be in your program and the part of Big FM.
Thank you so much. This is
ये वो हमारे सिस्टर कंसर्न है डॉक्टर सरला, ये टॉक एफएम है
100.3. But yeah, such a pleasure to have you, Dr. Sarla. You know, diabetes के बारे में कितना भी हम जाने, बार-बार याद दिलाना is also very important for all of us.
जी जी बिल्कुल.
So if you could just give a little bit of overview of diabetes 1, type 1 and type 2.
Yes, as we all know, we are dealing with the diabetes as we are having type 1 and type 2. Most of time we are dealing with the type 2 diabetes. Basically, type 2 diabetes, more than 90 to 95% of the patients we are having type 2. It is more is a lifestyle disease. We are getting this disease if we are having bad eating habits, overweight, lack of physical activities, though we are having insulin in type 2 diabetes, but not affecting well on the tissues. In type 1 diabetes, usually we are having 5 to 10% of patients, usually young adults. And type 1 diabetes, usually we are having lack of insulin, so they need insulin from outside.
That's right. Thank you so much for that, Dr. Sarla. Now अगर हम डायग्नोसिस की बात करें डायबिटीज़ को जहन में रखते हुए, तो क्या कहना चाहेंगी इस पर आप?
Well, regarding diagnosis, what we are dealing like in the hospital, we are finding out diabetes during the health checkup, and when the people come with a weakness, tiredness, feeling dizzy, passing more urine, we check the urine and also blood sugar. So if we are having fasting blood sugar more than 110, we are labeling them as a diabetes.
Mm-hmm.
And now what is very important, what we are dealing mostly with the pre-diabetes. Like
Okay.
they are having high blood sugar levels, but not yet in diabetic range.
Mm-hmm. And who do we screen diabetes for, Dr. Sarla?
Especially those who are having a strong family history of diabetes, overweight, people who are having high blood pressure, high cholesterol level, and certain people from the certain people Asian origin, and our GCC nationals, really they are prone for the diabetes, might be lifestyle, genetic, and
Dr.
lack
Sarla,
of physical activity as well.
Least age, if you can, just give a ballpark figure that what age people have come in when it comes to, symptoms of pre-diabetes or diabetes for that matter.
Well, nowadays we see even young people,
Mm-hmm.
even young people like 20, 25, they come for the checkup. We are seeing their blood sugar levels are on the higher side.
Wow. Okay.
So, and alarmingly, in GCC country, even 10% of the people, especially children, are coming with a high blood sugar level.
Is it? And when you say
Yes,
children, it's
yes.
more of teenage or even younger?
Teenage,
Okay.
15, 12, 15, 13, and especially after the COVID, what we have seen, 25% of the population of world has got obesity. So even with this alarming picture, we see many patients with a diabetes even in young age.
So, Dr. Sarla, is there a strong relationship between obesity and diabetes?
Yes, there's a very, very strong relationship between obesity and diabetes. And the second part also, lack of physical activity. What is happening in obesity? we have enough insulin in the body, but not working well on the tissue. And that is the reason they are getting the high blood sugar levels. If we do physical activity, with the physical activity, what is happening? Our insulin is working well on the tissue. So both parts are very, very important. If we are having lack of physical activity and along with that obesity.
In a week, Dr. Sarla, what is the minimum time? For example, a day, if it's like 15-20 minutes, is it enough in a day? Your heart rate goes higher, or more should be required? What would you say as a doctor, minimum?
What we are having recommendation from the American Diabetic Association, at least we should be physically active more than 30 minutes. For children, more than 1 hour. And more than 1 hour physical activity, we should sweat. Very good physical activity, at least 5 times in a week. And for children, at least for whole 1 week, more than 1 hour physical activity. These are the recommendations from the higher authority.
In fact, kids, they have overactivity sometimes. More than 1 hour, 5 hours they keep. Even that is a concern, is it?
Important nowadays, look at the children, they are having more of the sedentary, like their studies, their work, games, all is more with the gadgets. So they are lacking in the physical activity. Even nowadays, higher authority, what they are recommending, every hour, if you are working with the computers and gadgets, every hour you get up, move around and stretch. Don't sit for long. Sitting is not good for the health and also more chances to have a diabetes.
And before we let you go now, since Ramadan बस आ ही रहा है, कुछ ही दिनों में शुरू हो जाएगा, तो कुछ tips आप देना चाहती हैं, Dr. Sarla? Any tips for Ramadan diabetes management?
Yes, very important. If you are diabetic, if you are planning for the Ramadan, so very, very important. First, you consult with your doctor because some medication need changes in the doses and timing. Like some medications of diabetes, we are getting low sugar, so that we are changing from morning to evening, and very close follow-up with the doctor and regular blood sugar monitoring. And try, normally what we tell our patients, food should be healthy food. Like especially in iftar, should not be very heavy and too much sugary food. Simple, complex carbohydrates. You include fruits, vegetables, and salads, some yogurt, leban, and keep yourself well hydrated after the iftar. So at least the next day you will not get dehydrated. And very important for the diabetic, especially who are having other medical problem, if they are on insulin and they need very close monitoring of their blood sugar levels. And if they feel symptoms of hypoglycemia like weakness, dizziness, or feeling palpitations, they can check their sugar. And if sugars are getting low, they can break their fast.
Okay.
But definitely need very close observation, monitoring for them.
Thank you so much, Dr. Sarla. You've been so detailed, answering all our questions, and hope to talk to you very soon. Of course, for our listeners, allow me to, inform them. You're a specialist physician, diabetologist from Canadian Hospital, Dubai, on lifestyle and diabetes. So if our listeners want to get in touch with you, that's where you'll be found, right?
Sure, it's my pleasure.
Thank you. Have a great day, Dr. Sarla. Talk to you soon.
Thank you. Thank you very much for your time, and it's my pleasure to be part of it too.
That's very
Thank
sweet.
you.
Thanks once again.
सुनते रहिए टॉक ब्रेकफास्ट, बिजनेस अपडेट, उसके बाद ट्रैफिक अपडेट, उसके बाद सॉफ्टवेयर अपडेट, सब आ रहा है.
Talk 100.3 Business.
Business news and talk breakfast. आपको बता दें कि oil declined more than 7% during Monday morning. Trading on Wall Street as concerns over new lockdowns in China and the potential